Yeah, Dr. Amit, please
Yes.
introduce the guest.
So, good morning, all dear participants. You welcome again in the 21 days national refresher course on current development in veterinary and fishery sciences, jointly organized by the Rajwas, COFOS, and NADCL. So today we have the one more uh, resource person to deliver the lecture on advancement in management of orthopedic conditions in farm animals. So before starting the presentation, I would like to brief about the today's resource person, Dr. Anil Kumar Bishnoi. Dr. Anil Kumar Bishnoi is currently working as assistant professor in Department of Veterinary Surgery and Radiology, College of Veterinary Animal Sciences, Bikaner. On this post, he has experience of teaching, research, and clinical work of more than 12 years. His major field of research and clinical work is large and small animal orthopedics. As a major advisor, he has guided 14 MBC and one PhD student, and one of them 30 studies were conducted in the subject of orthopedics. He and his department team has developed the specialization in veterinary orthopedics with the establishment of every internal fixation technique for fracture management in small and large animals. At clinics of Rajwas, Bikaner, a good load of orthopedic cases in small and large farm animals are reported, and these are well managed by the use of linear and circular external skeleton fixation technique, locking, compression, and dynamic compression bone plating technique, intramedullary interlocking nailing, intramedullary elastic nailing, intramedullary K nailing, intramedullary start pinning, orthopedic wiring, and plate rod combination techniques. With the progression of time, the further advancement of further avenues of development of both small and large animals, orthopedic is being done at Rajwas, Bikaner. So, after this brief intro, I would like to request Dr. Anil Kumar Vishnu to start the presentation and address the delegates. Over to Dr. Anil Vishnu, sir.
Thank you, Dr. Amit. Thank you for this introduction about me and about the clinics, particular surgery department of the Rajwas Bikaner. As you mentioned in the introduction, we here receive a lot of cases, a variety of cases, both in small animal species and large animal farm animal species, in which number of orthopedic cases related to fracture, joint dislocation, musculoskeletal diseases, they are being presented here. And we take every step to treat these affections with whatever best possible new advanced techniques. So whatever techniques you have mentioned in the introduction, we will be going to discuss in this PPT also. So let's, first of all, I want to thank the organizer for giving me this chance, this platform to share our work, whatever we are doing here in the clinics of Rajwas Bikaner. So let's start this topic, that is advancements in the management of orthopedic condition in farm animals. If we talk about the orthopedic affections in farm animals, among them the most common affection is the fractures. As we see in small animal species, dogs, cat fractures are very common. Similarly, in these farm animals means if we talk of small farm animal species, are the sheep, goat. Then the large farm animal species are cattle, buffalo, their young ones that are cows. Then the equines, horses, their young ones, foals. We will be talking about these species, and particularly about what type of fractures occur in them and how we manage them with the advanced techniques. So if we talk about fractures, the limb fractures are more common in these animals. Long bone fractures, and if we see the occurrence or incidence of these fracture, the most common fractures in them occur in the lower limb bones, that is in forelimb metacarpal bones, in hind limb metatarsal bones. And after that, if we talk in the decreasing incidence, the next number comes of the tibia fractures, then the radius ulna fracture, then humerus fracture, then femur fracture. If we compare this incidence or occurrence of fracture in farm animal species, It's just opposite to the small animal species. In dogs, if we talk, the femur fracture incidence is highest compared to the other long bones. While here we see in farm animals, the femur fracture incidence is least. Then the other fractures in them, they occur are axial skeleton fracture. In axial, there comes the head region, vertebral region, and the pelvic bone. In these bones, the most common fracture occurs of the lower jaw, that is mandible bone. Them fractures are very common. Here we see that in newborn cows, when there occurs dystocia and such cases are handled forcefully, then in them mandibular fracture is very common. Even in the adult animals, due to any trauma, any fall down, any accidental trauma, the mandible fractures are common. Here, if we talk about in Rajwas, Bikaner, it's a desert place, so here a lot of camels are presented, and their breeding season in winter months, they becomes aggressive, and the mandible fracture due to this aggression in fighting between the animal, it is very common. So mandible fracture in axial bones are common, then the pelvis and sacrum bones. Now, what are the constraints which we face in the management of such cases, fracture cases in these farm animal species? They are heavy. These animals are having heavy body weight. So due to this heavy body weight, once the fracture occurs, the animals, most of the time it goes in recumbency, and because due to animal feels pain, limb function decreases, so animal becomes, due to its body weight, animals become unable to get up. And if the animal is unable to get up and it remains in recumbency, then whatever method we try for the immobilization, for the treatment of the fracture, it will not be fruitful. So first condition is that whenever the fracture comes in these animals, the animal should be in standing position. If it is in recumbent position, we should try every method to make it stand, like we can use, take the help of the slings to make them stand. And other is that when the body weight is heavy, when we go for the fixation of the fracture in these animals, the implant may get bent. It may, whatever the implant we apply, it may migrate out. So then the inavailability of heavy implants, if we want to go for the internal fixation in these farm animal species, then there requires whatever the implant which we use in small animal species, same implants, they are required in large animal species, but their size should be greater according to the body weight of the animal. So due to the heavy body weight in these animals, such implants are not available in the market. So this is the constraint. Then if we go for the internal fixation, then first problem we receive is that for the internal fixation, first requirement is that to be applied. But because of hormones in these animals, there are strong contractions in these muscles, and due to the strong contractions, the fracture fragments which get displaced, to bring them back into the anatomical position, that is called as fracture reduction, it is very difficult. So if it's an animal of large size, achieving fracture reduction is difficult. Then because of the heavy muscles, to approach the bone, when we give the incision on the skin, then separate the muscles and then reach to the bone, this reach to the bone is difficult. Because of the surrounding muscle mass, they are very large in size. So the bone are situated more deep. So working at the deep level, it is not easy. At deep level, we have to work, we have to reduce the fracture, we have to apply the implant, so we get very less space. This is the constraint. Then anesthesia maintenance in large animal, when we go for the internal fixation, then general anesthesia is required. But we know that in large animal, keeping the animal in general anesthesia is some bit difficult. Then if we compare with the small animal species, there occurs problem of regurgitation of feed water material, the development of tympany. Then due to the heavy body weight of the animal, the limb which is on the bed, it remains compressed for a longer duration during the surgery. So when we, after surgery, we want to make the animal stand, animal is not able to get stand easily because of the decreased blood supply of the muscle, the nerves get compressed, so animal is not able to get up easily. Then the cost factor is a constraint. Implants, heavy implants are required, they are very costly. Then after post-operatively, the care of the patient, it requires also a cost, that is a constraint. Then internal, when we go for internal fixation, it takes a lot of time, surgical procedure. Then if we compare with the small animal, the owner and animal compliance, they are poor in these farm animal species. Owner, most of the time, owner in these, their owners, they are less educated. So what we ever we counsel them, they are not able to follow that thing. And also the animal is not as smart as the small animals, so they may jump, they may enter into some place and they may spoil the surgical site, uh, 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 or the implant may get bent, so this compliance is also poor. Then post-operative complications are more because these animals remain in the environment which is having more contamination, so complications are more. And if we talk about the goats, in them the bone cortex thickness is very good, but the bones are brittle. So when we go for the internal fixation, we have to handle the bones of these animals very carefully because they may get break easily. But still, there is a silver lining in this dark cloud, in this farm animal orthopedics. What are this silver lining? What is the benefit we get when we go for the surgical treatment of these orthopedic condition in the farm animals? These benefits, if we talk of them, they are that these animals, they spend most of the time lying down. They are not as small animals, dogs, cats, which always keep running here and there, jumping on something. In contrast to that, these farm animals, they remain peaceful at one place, and most of the time they remains in sitting position. So this is advantageous for us. It will, there will come less load on the implant, so chances of the implant breakdown, migration, they are less in these animals. They have a tremendous, these farm animals, the bone healing capacity is very good. Means once the fracture occurs, you immobilize this fracture, the healing occurs very fast if the fracture is good immobilized, because the periosteal reaction is very good, the callus formation occurs very fast and in abundant amount. Here you can see two radiographs. It is a pre-operative radiograph of a humerus fracture, and it was stabilized with the intramedullary stack, meaning see abundant amount of callus is formed at the fracture site. So this benefit we get in these farm animals. Then if we talk of the bovines, once we treat one limb, suppose left hind limb we are treating, then what happens that for some period animal start taking weight on the contralateral limb. So due to continuous more weight on the contralateral limb, there occurs hyperextension of that contralateral limb, and due to more stress there can develop laminitis. But in these bovines, the chances of development of this hyperextension and laminitis, they are less, but it can occur in the equines. So these are the benefits which we get in the farm animal orthopedics. Now let's talk about what are the different fracture immobilization methods. Let's first start from the basic which we routinely use, that are the external immobilization method. Then we will come up to the advanced techniques, that is internal fracture fixation techniques. In external immobilization methods, the techniques which are commonly used are the POP or fiberglass cast along with the splint. So this is a cheaper technique, easy to apply, and it's a good technique for the if the fractures are of the lower limb bones. Lower limb bones means of the metacarpals, metatarsal, distal radius ulna, distal tibia fractures. They can be well managed by this immobilization technique. But if the fractures are of the upper limb bones, means humerus, femur, or the proximal part of the radius ulna or of the tibia, then they cannot be immobilized by this technique, because we know that the principle of this application of this technique is to immobilize one upper and one lower joint of the fractured bone. So when the fracture is of the upper limb bones, we can't immobilize the upper joint in such cases. Now, this is good technique, but there are some disadvantages with this technique. One is that upper limb bones cannot be immobilized with this technique, and if we suppose that is tibia fracture of the proximal proximal end, and we want to apply the this cast, so we have to immobilize the stifle. We have to include the stifle joint also. But what happens that in large animal, due to this wide part of this thigh region, stifle region, the POP can get slipped down. So here this technique will not work. Then if the fractures are open, then if we go for this POP cast or fiber cast application, then the management of the wounds of such fracture is difficult, because we cannot flush the wounds regularly. We can just do superficial dressing, and by superficial dressing it will not work, and the infection develops in the deeper tissue. Then as we have to immobilize the joints in this cast technique, so and this cast remains for a longer period, for 2 to 3 months. So in this period, what happens that the joints become stiff. So even if the fracture heals, but when we remove this cast, the animal will not be able to use its limb properly. The limb may not be functional, because the joints have got stiff, and they require a good physiotherapy for a longer period after removal of the cast, so that the flexibility of the joint reappears. So here we will see the cases. We will discuss the cases in which we apply this technique. So here you see adult mare. It's having the first phalanx fracture, longitudinal split is there, and here we applied the fiberglass cast, in which the fiberglass cast was applied from the foot region up to the proximal part of the metacarpal. And see, once the cast was applied, this fiberglass cast gives a good rigidity. So see the animal, how good it is taking weight on the affected limb. So if we compare the POP cast and the fiberglass cast, the fiberglass cast, it gives more rigidity, more strength. Then it's another case of an adult mare in which there is a metacarpal fracture, severe comminuted metacarpal fracture. See, the bone is completely splitted in its full length, and there is a small puncture wound was present on the skin surface. So we can grade it, such a small wound is present at the fracture site, we grade it as a grade 1 open comminuted fracture. So in this also fiberglass cast was applied, and a window was kept for the regular dressing of the wound. Now the another technique which we can use for the external immobilization is Walker splint application. What Walker splint? Walker splint can be used for both the forelimb and the hind limb, and it works better for the bovines. It is not used for the equines, but works used in the bovines, in small young bovines and in adult bovines. So if we see the components of this Walker splint, it consists of a ring, then comes two parallel leg bars, Then at the base of this leg bar, there is a foot plate having multiple holes. So this immobilization technique can be used for the fractures of lower limb bones, that is metacarpal, metatarsal, radius, tibia fractures, but not again for the humerus and the femur fractures. Because if we use this Walker's splint for the humerus and femur fracture, then what happens? The ring of this Walker's splint, it acts as a fulcrum for these humerus and femur bone, and which will lead to more instability of these bones. So instead of providing stability to the bone, it will lead to the instability of the bone, and the fracture healing, it will be delayed, or it may change to non-union of the fracture. So it is avoided in the humerus and femur fracture. Advantage of this Walker's splint is that it is very good for the open fractures of these lower limb bones. The wound can be easily managed. So when we go for the application of this Walker's splint, how it is designed, we have to first take the diameter of the ring. It is determined. How it is determined? If we talk of the hind limb, the diameter of the ring should be from the proximal end of the femur. There is bony prominence called as greater trochanter, and then up to the stifle joint. This distance, this will work as a diameter of the ring. Or we can take from the tuber ischii to the tuber cocci as the diameter of the ring. So it is very important. If the ring remains small, then it will cause irritation to the surrounding soft tissue, and then there can occur pressure sore and wound in this region. So it works very good for the fracture which are open. Regular dressing can be done with the immobilization of the limb. Then if we talk of its application in the forelimb, the ring diameter is decided by measuring the distance from the point of elbow to the point of the shoulder. This distance is calculated as diameter of the ring. Now, other that is ESF, external skeletal fixation. This technique is very popular in the farm animal species, even in the goats, in cattle, buffalo, in equines. Its chief advantage is that its application is easy. It's not involving too much cost. Particularly, it is very good for the immobilization and management of the open fractures of the limb bones and of the jaw bones. So if we talk about the ESF, external skeletal fixation, it's of different type. Let's see first its classification. One type is ESF, in which we use the transcortical pins, clamps, and connecting bars. Here you see it's of two types. One is linear ESF, other is circular ESF. In linear ESF, Steinman pins are used. They are inserted in the proximal and distal fragment through and through, and these pins are called as transcortical pins because we have inserted through the cortex of the bone, so they are called as transcortical pins. So pins are inserted both in the proximal fragment and distal fragment, and the external end of these pins are connected. After reducing the fracture fragment, the external ends of these pins are connected by a connecting bar, taking the help of the clamps. So this frame, it will keep the fracture immobilized, and at the same time we can regularly dress the wound. Here you can see the linear ESF. It's applied in a grade 4 metatarsal fracture of a camel calf. The wound was severely infected. The bone was necrosed. So in this case, the wound was debrided. The necrosed bone was the sequestrum of the bone was removed, and then it was immobilized with this linear ESF. Then there is circular ESF. In this, in proximal fragment, at a level, two pins are inserted in the crossed manner. Similarly, pins are inserted in the distal fragment in crossed manner, and these pins are externally connected to a ring having multiple holes. Then the rings of the proximal fragment and distal fragment, they are connected to each other through threaded connecting bars with the help of bolts. So here you see the circular ESF. Here it is neutralizing the force in all the direction of the bone. In the complete periphery of the bone, whatever forces they are acting, it is able to neutralize them. So this circular ESF, it provides more stability than this linear ESF. So if we feel that the animal is heavy, the fracture is more unstable, that is comminuted fracture, in that case we should select the circular ESF. Otherwise the linear ESF works, because disadvantage with circular ESF is, one thing is that its application, it's time consuming. More instruments are required. ESF assembly components are more, so more cost is involved, and it's more time consuming. So circular ESF is kept reserved for the more comminuted type of fractures for the adult animals. Then another type of ESF, that is transfixation, pinning and casting. Here we are using the transcortical pins as in the linear ESF. In the proximal and distal fragment, the transcortical pins are inserted. But here the external end of pins, they are not connected by the clamps and connected bar. But instead of that, either fiberglass cast or POP cast is applied around the limb, incorporating the external end of the pins. So advantage of this technique is that it involves less cost, because use of the clamps, connecting bar, they involves the cost. But if we use the fiberglass cast, then its cost is less. But one thing is that this technique can only be reserved for the simple closed type of fractures. In open fracture, this technique cannot be used, because if you apply the fiberglass cast, then you cannot go for the regular cleaning of the wound, regular flushing of the wound. Then other type of external skeletal fixation technique is hanging limb pin cast. It is particularly used when there is fracture of proximal end of radius ulna or proximal end of the tibia. Here, if we go for the application of simple POP cast, then we have to involve the elbow joint in the forelimb and the stifle joint in the hind limb. But what happens that due to the wider end of the limb above the elbow and above the stifle, the cast can get slipped down. So to prevent the cast slipping, what we do, we insert 2 or 3 pins. See here, 2 or 3 pins in the proximal fragment, and then we apply the POP cast involving the stifle or elbow joint and full limb up to the foot region. Now what will happen, these inserted pin, they will work as hanger and will prevent the slipping down of the POP cast. So here you can see it is a hanging limb pin cast, and near to it is TPC, transfixation pinning cast, as we have seen in the previous slide. Now other form of ESF is free form ESF. In this, the transcortical pins, they are inserted in the proximal and distal fragment. And free form word, why it is used, because here we are having the freedom. Here we are having the freedom of externally connecting the pins, because earlier we have seen that when we go for the linear ESF or the circular ESF, the pins of the proximal fragment and the distal fragment, they should be in a one line so that the clamps and connecting bar can be connected to each other. But here we can insert the pins in any direction in the proximal fragment and distal fragment, and then the external ends of the pins, they are bent towards each other, and then the bent ends of the pin, they are connected with the help of material called as epoxy, which we commonly use in our houses, that is M-seal, or we can use the acrylic material. The property of this material, acrylic and epoxy, is that they hardens very quickly. So once you achieve the fracture reduction and apply this epoxy, within few minutes or within half hour, this material, it gets completely rock like hard, and it gives good stability to the fracture fragment. And here we can do the regular dressing of the open fracture in such case. Now here we see we will see a lot of cases here in our clinics we have done, in which we have applied the this ESF technique. Here is the case one, which is having a metatarsal open fracture of mid diaphysis. So here you can see the linear ESF applied, the transcortical pins inserted from one side, exiting from other side. This form of ESF, it is called as bilateral uniplanar linear ESF. Why it is called as bilateral? Because we are inserting pins from one end, exiting pins from the other side, so it's bilateral. But the plane is single, one plane, so it's called as uniplanar and bilateral ESF. Then this is a case of adult mare. Due to trauma, what happened that in right hind limb, the fetlock joint get dislocated, and it was an open dislocation. The distal end of the metatarsal condylar end, it came out, and it was, the wound was infected when it was presented to us. So here you see the two radiographs, the complete dislocation. So such fracture cannot be treated by simply reducing and immobilizing the fracture, because this is not a ball and socket type of joint. Once you remove the immobilization, then the dislocation will occur. So we have to treat such fracture by performing the arthrodesis. Means we have to surgically fix this joint after resecting the articular ends of the bones. So here we have used the bilateral uniplanar, again bilateral uniplanar ESF, but it will be called as a transarticular bilateral linear ESF, because we have applied the pins beyond the joint. 3 pins are inserted in the metatarsal bone, and 3 pins are inserted in the first phalanx joint. So the ESF assembly is crossing the joint, so it's called as transarticular ESF. So see here, wound after resection of the articular surface, how it is appearing. Now here you see how the animal is taking, after a short period, only 4 days after surgery, the animal is taking good weight on the limb. So it provided a good rigid stability. See, the animal is very heavy, adult mare, but still it provided a rigid stability. Animal is taking weight on the limb. See, even after 4 weeks, the assembly is intact. All the transcortical pins, complete assembly is intact. Here we can see the wound which was present earlier. Now it is filled with the granulation tissue. In horses, there is a property formation of proud flesh. So see, the proud flesh is formed. The bone is now completely covered with this proud flesh, and this proud flesh can be treated by resecting it. So we can see that how this linear ESF can be used even in such heavy body weight animals. See, this another case, distal physial open fracture of metatarsal in a calf. See, it was also infected case. So this was also treated by transarticular bilateral uniplanar linear ESF. The pins are inserted in the proximal bone, that is in the metatarsal, 3 bones inserted in metatarsal through and through. Then in the first phalanx, and threaded pins, they are inserted. They are not inserted through and through because they are present separate digit, medial and lateral. If you insert through and through, then there comes a soft tissue between these digits. So here we can't apply through and through pins, but we are using such pin application is called as half pin. So half pins are inserted in the first phalanx and then they are connected with the clamps and connecting bar. See, after application of the ESF assembly, it is kept covered by the cotton padding and bandaging so that externally the dust, sand, it do not infect the site. And if open fracture, regular dressing is done after 3 to 4 days. See, in this case, on the medial part of this metatarsal, the sequestrum was formed, so it was removed. But see, the lateral part, it has got completely healed, make union with the epiphyseal end of the bone. And after assembly removal, here we can see the bone union has taken place. And here we see the animal is taking good weight on the limb after the ESF assembly removal. So with time, this weight bearing will further improve. See, it's heifer. Earlier it was calf. When the bone gets healed, it at that time it has come to the stage of heifer. See another case having the metatarsal open distal physeal open fracture in a heifer. It is again managed with the transarticular bilateral linear ESF. See, it's another case. It's a fracture of the hind limb, proximal part of the metatarsal, open fracture. The fragment is also split. We can see the split in this fragment, proximal fragment. So it's again managed by the transarticular bilateral linear ESF. Here, the pins are applied in the proximally in the tibia bone. Then 1 pin is applied in the proximal fragment of the metatarsal. Then 3 pins in the distal fragment of the metatarsal. So see, then this is a case of a camel having severe comminuted fracture of the mandible. It was an adult male camel. It suffered from a mandible fracture in its rut season, and in the field it was attempted for its treatment by the interdental wiring. But because the fracture was comminuted, so overriding of the fracture fragments took place. And see here, after the wiring application, the fracture is found collapsed. So from field, it was brought to us, to our clinic. And so such fracture can be managed either by the bone plating or by this ESF technique. So here we see the ESF is applied. How it is applied? In the distal, the caudal fragment of the mandible, 3 pins are inserted on either left and right side. Both sides, the 3 pins are inserted. And then in the rostral fragment, these 5 pins are inserted. And then the external ends of the pin, they are connected by a corrugated tube. And then in this corrugated tube, the epoxy, that is M seal, is filled. So here we can see the fracture, good fracture reduction is achieved. And in this lateral radiograph, in this dorsoventral radiograph, we can see how good the fracture is immobilized. Then if the fracture is not comminuted type, then in camels, such fractures can be managed simple by interdental wiring. See, in camels, the fractures, the common site of mandibular fracture is in this diastema region where the tusk teeth is present. What is tusk teeth? Tusk teeth is the first premolar teeth in camels, and this first premolar teeth is not along with the remaining premolar. It is situated more cranially than the remaining premolar, and this site is common for the mandibular fracture in camels. So if the fracture is not comminuted, it's simple transverse or short oblique fracture. Such fracture can be managed by interdental wiring. In interdental wiring, what is done? We can use either the stainless steel orthopedic wire or a copper wire of size 2 mm to 2.5 mm. It is passed between this second premolar and third premolar teeth, and its rostral ends are passed between the incisor, here you see, and then the knot is placed. Such wire is placed both on the left side and right side, and as we tighten the wire knots, it will lead to the stability of the fracture fragments. So it's a very common technique, interdental wiring. It's used in the camels. See, again, the use of ESF in the management of mandibular fractures in cattle calf. This is a calf having this mandibular fracture. Two pins are applied in the caudal fragment on both sides, left and right hemimandible. One pin is passed between the central incisor in the incisive bone, and then this corrugated tube is applied, filled with the epoxy. Then let's come to the internal fracture fixation techniques in these farm animals. So let's see one by one. First is intramedullary pinning technique. It's a very common technique, very earlier technique, which is being used as an internal fixation technique. So when we use this intramedullary pinning, commonly we use it as a stack pinning. Because what is stack pinning? In this, we place two or more than two pins into the medullary cavity of the long bone. So by this, what happens? These more number of pins, it gives good stability to the fracture fragment, and also there occur good contact between these pins and with the endosteum of the bone in the medullary cavity. So the chances of migration of the pins are very less with this stack pinning technique. So this stack pinning technique can be used for the transverse fracture, oblique fractures, spiral fractures of the humerus bone, of the femur bone, of the tibia bone in these farm animals. But it cannot be used in the radius fractures, because in radius we do not get a surface to insert the pins. So here I am showing a case of humerus fracture in a cattle calf. It's a mid-diaphyseal long oblique fracture. In these three Steinmann pins are inserted, and because it's an oblique fracture, the fracture is also stabilized using orthopedic wire, which is applied in circlage manner. So this orthopedic wire applied in circlage manner, it will prevent the overriding of the fracture fragment post-operatively, and also it will generate compression between the fracture fragments. So the chances of rotation of the fracture fragments, they are less. See here, this case is having a good follow-up. See, at 7th week, you can see the periosteal reaction at the fracture site. Then here, still the assembly is intact. 11th week, 15th week, it is intact. The pins have not migrated. But here you see 11th week, the circlage wire which was applied, it need to be removed, because externally a wound developed, a small wound developed due to the knot of that wire, and so that wound was not healing. So that wire was removed at this 11th post-operative week, but the pins are still intact and good callus is formed. And after the pin removal, see, the fragments are stable with the good callus, and see how good the animal is bearing weight. See, pre-operatively, the weight bearing, and the post-operatively we can see how animal is totally normal. Complete weight bearing is present in this animal. Now, next technique for internal fixation that works very good in large animals, in large animal particularly in even in the adult animals of cattle, buffalo, horses of body weight of around 200-250 kg. This technique can be used, that is intramedullary interlocking nailing. What is intramedullary interlocking nailing? In this, there is a nail. It's having holes, 4 holes in the its proximal part, 4 holes in the distal part. The nail is placed into the medullary cavity with the help of a device called a zig or aiming device. Now, this aiming device has holes, and these holes correspond with the holes in the nails. So, through these holes, we drill the hole in the bone through the this nail hole, and we apply the screw. So these screws placed in the proximal fragment and distal fragment, they will prevent the migration of the nail from the bone. They will prevent the rotation of the fracture fragment after the implant application. Because if we see, if we apply the simple intramedullary pin in the intermedullary cavity, then the chances of migration of the pin, the rotation of fragment are common. But these, whatever the advantages which were there with the pinning, now they are not present with this intramedullary interlocking nailing. So here you can see a case having a humerus diphyseal oblique fracture. With the help of this aiming device, a nail was applied, 2 screws were applied in the proximal fragment, 2 in the distal fragment, and along with that, the circlage wire was applied. See, even after 8 months, the implant is stable. The fracture has got completely healed. The implant was removed, and see, the complete union is achieved in the humerus fracture. So this interlocking nail gives very good stability, and this technique can be used for the humerus bones, for the femur bone, for the tibia bone. Another case in which interlocking nail is applied, it's a femur fracture in a buffalo calf, long oblique fracture. In this, the intramedullary interlocking nail is applied. See, when we apply the screws both in the proximal fragment and in the distal fragment, then this technique is called a static intramedullary interlocking nailing technique. But if we apply the screw either in the proximal fragment or in the distal fragment, and one fragment is kept free without the screw, then it is called as dynamic interlocking nailing technique. So here again, the screws are applied in proximal and distal fragment. It is a static intramedullary interlocking technique. See, after the application of the this interlocking, animal is bearing good weight on the limb. See, another case of femoral diphyseal long oblique fracture in a buffalo calf, again repaired with interlock nail, 4 screws in the proximal fragment, 4 in the distal fragment, along with the circlage wiring. See, again we can see the animal is taking, this is the early post-operative video. See, even in the early post-operative period, the animal is taking good weight on the limb. So with the passage of the time, the healing occurs and animals start taking good weight on the affected limb. Now, there comes another technique, again, intramedullary fixation. That is with the intramedullary K nailing. K means conchair nailing. Here you can see the conchair nail. Its design is of like clover leaf. This clover leaf like design, it gives a good contact area between the endosteum of the bone and the implant. So its application is also easy. This can be applied in the humerus bone, femur, and tibia bone. See, it's a mid-diphyseal short oblique fracture of a cattle calf. See the fracture fragments, how they are displaced. This K nail is applied. See the complete good reduction of the fracture fragment. So this is a pre-operatively video. Another case of humerus fracture in a cattle calf. It's having distal metaphyseal fracture of humerus. So it's again stabilized with this K nail. Now then there comes technique bone plating. If we talk of all internal fixation techniques, this bone plating technique, it can be used for all type of bones. Means even for the mandible fracture it can be used. In limbs it can be used for the humerus fracture, for the radius ulna fractures, for the femur, for the tibia fractures, for the metacarpal, for the metatarsal fractures. So latest new advancements in this bone plate is the locking compression plate. What is locking compression plate? In this, the holes of the plate, they are threaded. And what the screws which we are using in this plate, the heads of those screws, they are also threaded. So once we apply these screws through this plate, the heads of the screw, they will get locked with the plate. So what will happen? There will become a single entity of the bone plate and of the screw. So it gives more rigid stability to the fracture. So in these farm animal species of good body weight, such locking compression plate, they are more advantageous. The chances of migration of the screw are lesser. The chances of loosening of the plate due to the migration of the screw, they are lesser. Here you can see this is a oblique fracture of the humerus in a cattle calf. It was managed by the application of this locking compression plate. See, along with locking compression plate, surface wiring is done. So in large animals, these plates come in different sizes. In small animal species, dogs, cats, we use the plates of size 2, 2.7, 3.5. But in large animal species, the plates which are used, they are of 4.5 size. And in 4.5, also there comes narrow plate and broad plate. So we commonly use the 4.5 mm broad plates. Even in the adult animal, there comes the locking compression plate of 5.5 size. What these 5.5, 4.5, 3.5, 2.7 and 2 means? It means these are the sizes of the screw. If I am talking of the 4.5 mm plate, it means in this plate, the screws of 4.5 mm diameter, they are applied. So larger the animal means more the body weight of the animal, more bigger size plates which we use. See here, this is an adult goat having a humerus fracture, comminuted humerus fracture. So such fracture was requiring a good rigid stability. So it was immobilized using the bone plating, and along with the bone plating, we have applied this intramedullary pinning. So this fixation technique, it is called as plate rod combination technique. It gives plate rod combination, it gives more rigid, more stronger stability to such unstable comminuted fractures. See, this is a video of the animal operated and external support provided by Robert Jones. Bandage, the animal is not able to stand by own. So by support for few days with external support from the animal owner, it was made to stand. See, again the use of bone plating in mandibular fracture. This is a case of adult she buffalo having the bilateral mandibular fracture from this diastema region. So it was repaired by applying the bone plate. In this, the bone plate which is used, it is SOP type of bone plate. SOP means string of pearls bone plate. So see, why it is called a string of pearls? Because it's having beads in which the holes are present for the application of the screw, and between the beads there are present internodes. So this plate is applied unilaterally on the right hemimandible. It was applied, but it was giving, once it was applied, it was giving stability to the complete fracture. See, on the next day of the surgery, the animal is able to take feed. Such a good stability is provided with the bone plating. And 3 weeks post-operatively, animal is using its jaw. There is no hanging of the jaw. The surgical wound is healthy. Animal is able to do rumination. So plates can also be used very nicely for the mandibular fractures also. Then comes the technique orthopedic wiring. Orthopedic wires, they are of stainless steel, comes of different diameter, like 16 gauge, 18 gauge, 20 gauge, 21, 22, 24 gauge diameter. The use of these orthopedic wire, one we have seen that they are used in long bone fracture along with the intramedullary fixation techniques or with the bone plating technique. As a circlage wire, they can be applied. Then they can also be used for the repair of the mandibular fracture. See, here is a case of a adult buffalo having the mandibular symphysial fracture. Means between the two hemimandibles, left and right, at the rostral part, there is mandibular symphysis. From here, it is fractured. Along with that, the right incisive bone, it is also fractured. Here, you see the lateral radiograph. This is the right incisive bone fractured. The incisor bones, they are hanging down. So it was immobilized with the help of this interdental wiring. With the help of orthopedic wiring. How it was applied? It was applied to repair this mandibular symphysial fracture. The wire was applied as an interdental wiring. Means the space between the teeth, as which we see externally between the crowns of the teeth, between these, the space between the crown of the tooth, the wire is passed and then not applied, then it is called as interdental wiring. So for symphysial fracture, interdental wiring was done, and for the incisival bone fracture, the interfragmentary wiring was done. What is interfragmentary wiring? One hole is drilled in the rostral fragment, other hole is drilled in the caudal fragment, and through these holes, the orthopedic wire is passed and the knot is placed. And as we apply the knot, it holds both the fracture fragments together. So see how nicely we are able to get the fracture immobilization, fracture reduction with this orthopedic wiring technique. It's another case of a newly born cattle calf. It was a case of dystocia. It was handled, and with this, the mandible fracture occurred. Here also, the fracture was between the symphysis, that is mandibular symphysial fracture, and along with that, the left incisive bone is fractured. So here again, you see the interdental wiring was done to stabilize the symphysial fracture, and the incisional fracture was repaired by the interfragmentary wiring. So here we find the use of the different techniques, internal fracture fixation techniques for the repair of different type of fractures, that are mandibular fractures, limb bone fractures, and in them we talk about the use of the intramedullary pinning as a stack pinning, then interlocking nailing as intramedullary interlocking nailing, then K nailing for the intramedullary fixation, then the bone plating, either alone bone plating or the plate rod combination can be used. Then we saw the use of the orthopedic wires for the fixation of the mandibular fracture as a extra support for the long bone fractures, their oblique fracture, comminuted fracture. They are stabilized by other fixation techniques, and as a circlage wire, it provides good support in these long bones. So here we can see that these techniques can be used in these farm animals. What thing we have to take care is that if the animal is having too much body weight, then it's not uh, right thing or not a good decision to use this internal fixation technique, because in heavy adult animals the approach to bones is very difficult due to heavy muscle mass. Achieving reduction of the fracture fragment is very difficult. So in them we should not opt this internal fixation technique, but we can use this technique in animals of having body weight 200-250 kg body weight. And then one more thing important is that in them the post-operative care is very important, because their environment is such that they carry environmental infection very easily. So the surgical wound, it should be well protected. The surroundings should be kept well neat and clean, so that any post-operative complication wound infection do not develop in these animals. If we take good post-operative wound care, then the outcome of the internal fixation is very good. So this is what we discussed in this presentation of the management of the different fractures in the farm animals. So thank you very much. Dr. Arun?
Thank you, sir.
If any participant have query regarding the topic, so he or she can ask to sir.
Yes, please, if participants have any question, the queries, they are invited. I will be happy to answer them. Dr. Amit, how many participants are there in this 21 days training?
Sir, approximate sir 100.
100. Okay.
Yes, sir.
Good.
Yes, sir.
And all
Okay,
are
I think, sir,
they are faculty members or also students?
no, sir, most of are the faculty members, because it is of 21 days, sir. 21 day refresher course. So it is needed for faculty, sir.
No, students are also allowed in this training?
Yes, sir. Students are also allowed, sir.
Okay.
Most of are in PhD, sir.
All right. All right.
Most of our PhD students. Okay, if they don't have any query regarding our topic, sir. So thank you, Dr. Anil, sir. Thank you for delivering such a nice lecture. I think the participants have learned a lot about your experience. So thank you for sparing the lot of time